Hello, my name is Jackie Shapin, and I am here for Ask an Expert Live OCD with No CD. And I am so sorry that I'm late. We had some technical difficulties with me being able to log on, but we're here and we got it all figured out. So just feeling a little bit of that anxiety. So I can probably relate to a lot of you right now, but we made it. So welcome. I'm so happy to be here. This is the start of OCD Awareness Month. OCD Awareness Week is all next week, and I'm really excited to kick that off with this Ask an Expert Live. So I am going to be here for the hour, and I'm going to try to do my best at talking about and answering as many of your questions about OCD as I can. I'm also going to share some resources that I really enjoy for those of you that love a good book or a podcast to listen to, not as a compulsion, but as a psychoeducation, to help you just have some more resources and help with OCD, along with obviously no CD. So I'm going to get started and look at some of these questions that I'm getting. All right. Okay. All right. Apologies if I say any of your names wrong today. Gaga POD said, I accidentally crossed my eyes a bit and now feel the urge to cross them on purpose. Will the right thing to do be do it once and ignore every other urge, or ignore it completely? Thank you. All right. So I should say this is not therapy. I'm helping to give as much information as I can about OCD and to help you specifically with your questions. I would need to know a little bit more to know exactly like what is the right thing to do. But I think even I'll start there is I don't want you to try to think of the right thing to do. What is actually great is to do the wrong thing in cases like this. So if you are feeling the urge to cross your eyes on purpose, do it wrong. Don't cross your eyes. If anything, do whatever would make that urge still be there. So if you are feeling the urge to cross your eyes, can you resist that compulsion and sit with the feeling of wanting to cross your eyes and not doing it? Again, if you don't have OCD and this is just a random urge that you have, obviously it's okay to do it. Obviously I'm answering in the assumption that you have OCD. Let's see. All right, Nas Koto. Again, apologies for saying anyone's name wrong. How do I share the content of my fears with my therapist when most of the time I'm convinced that my real event OCD fears are true, that my past actions are serious crimes, and that I'll be reported? All right, so this is a great one. I think this brings up so much. So let me kind of slow down and answer as much as I can about this. So when you are going to therapy and you believe you have OCD, it's really important that you find a provider that is trained and has their specialty in OCD so that they know what to look out for when you're coming in. So if you go to a therapist that doesn't know about OCD and you start sharing things that need to be reported, someone without knowledge of OCD may unfortunately think they need to report you, versus knowing that you may just have these intrusive thoughts, or that you may have real event OCD and fear that you did these things. So a trained professional in this area is hopefully not going to steer you in the wrong direction. If you know that this is a content of a fear and that you struggle with real event OCD and your therapist knows this about you, then it is completely okay to share the content of your fears with your therapist, especially because, again, I'm looking at this again and it says my fears. So your fear is that you did something. So it would probably be an exposure for you to tell your therapist. And the only reason why I gave that caveat in the beginning is because if a therapist isn't trained in OCD and doesn't know it, then that can do harm. But if you're seeing your therapist, they know you have OCD, they know this is something you struggle with, then this would be a great exposure for you to share the content of your fears. The other thing is a licensed clinician is a mandated reporter when it comes to child abuse, elder abuse, dependent adult abuse, or if you're going to harm someone else or yourself. And so if you're talking about the past, then it's okay it's not reportable. So if you're talking about that you already did something and it isn't related to child abuse, elder abuse, or dependent adult abuse, that isn't reportable. All right, I don't want to say too much more because I don't want to provide reassurance if I already have. That wasn't my intention. Hopefully that was helpful. Oh, you shared more. Real event OCD. How do I make myself apply ERP when I'm convinced I don't deserve peace and that I'd be in jail or hated if people knew about my past? I can't allow myself ERP because of all this. So a huge part of best treatment for OCD, along with ERP, is self-compassion. Whether you did something or not, everyone deserves self-compassion. Again, I don't know the details of this. I don't know if you did something or not. And so I would need to know, more about this to get into the nitty-gritty. But when you said, I don't allow myself ERP because I don't deserve peace, that sounds like it's more self-punishment as a compulsion. Because even if, let's say you did something, that is separate from having OCD and using ERP to expose yourself to your fear and to practice relapse prevention. Everyone deserves to get treatment. And self-punishment can be a compulsion. And so I want all of you to kind of ask yourselves, is there anything I do that might be self-punishment as a compulsion? Not allowing yourself to do something because you have OCD. Making yourself do things that you don't want to do because you feel like you deserve it because you have OCD. Those are some examples of self-compulsions within OCD. I keep obsessing over whether my best friend still likes me, if our relationship has changed, or if I love her. Can you talk about ROCD in friendships? I keep doing checking rituals like reassurance. Thank you so much for bringing this up. So ROCD stands for relationship OCD, and relationship OCD does not only show up in intimate relationships or with a single partner. Relationship OCD can show up with friends, with coworkers, with family members. So it can show up in any relationship. And oftentimes it shows up with our important relationships because OCD attacks what we value the most. So it makes sense that it might attack your relationships that really mean a lot to you. I want to recommend a really great book for you, Ko, that talks about exactly what you're talking about. And it's Relationship OCD by Shiva. I'm so sorry, I don't know how to pronounce her last name, Shiva Rajai. I also posted a picture of some recommendations of books I have on my Instagram. If anyone wants to check that out or wants to follow me for some more OCD support, my Instagram is my name, Jackie Shapin, and then therapy, and that's my Instagram handle. So, and I tagged the author in my most recent post. So this is going to talk all about relationship OCD. Relationship OCD, I want you to think of just like any other theme, where you're going to have the obsessions like intrusive thoughts like, does my best friend like me or not? If our relationship, I don't know if it's changed or not. Do I love her or not? Those all are obsessions. And then compulsions, there may be different compulsions with ROCD, and here's some examples. So one of them, like Ko shared, was reassurance. So asking her friends or asking this particular person, do you still like me? Has a relationship changed? I don't know if I love you or not. Can we talk about it? Those are all seeking reassurance, which are compulsions. And it's a compulsion if you're doing it to try to reduce anxiety. And if you do it and it gives you temporary relief, but it just keeps coming back around. And that's what makes a compulsion a compulsion. It's something you repeatedly do as a way to bring down anxiety, but it's temporary, because if it wasn't temporary, then it wouldn't be a compulsion. You would check in with this person, they would say everything's cool, and you would move forward. But what happens with OCD, especially ROCD, is you ask them, and then an hour later, a day later, or a week later, that thought comes back. even though you already asked them, and even though you already got that reassurance. So reassurance seeking is a compulsion. There can be other things like, I wish I had my list handy with me, but there can be behavioral compulsion. So, and you might have magical thinking where you have to do this ritual in order to make sure that this relationship is okay. That can tend to be a compulsion. To have magical thinking is when you have thoughts that you believe. Magical thinking is believing that your thoughts and things you do can actually have the power to make something happen. So like, I thought a bad thought, and so therefore something bad is going to happen. Or I need to touch X, Y, and Z, or else my relationship's not okay. That is magical thinking. When you have these irrational thoughts that you believe are true and that you have to follow out. Again, apologies if that didn't make a lot of sense. So again, magical thinking is this idea of if I think something, then it must happen or must be true. And we already know thoughts aren't facts. And that if that was true, then I would say I want $1 million and $1 million would just fall in my lap. So I think I maybe confused you. So that's magical thinking. Having irrational thoughts is a huge part of OCD, obviously. And so you might have behavioral compulsions like, I need to do X, Y, and Z in order to make sure that X, Y, and Z is okay. It doesn't make sense, but that is OCD. Sorry, that's OCD, not magical thinking. Now that I confused you enough, I'm going to just continue. So ROCD also might sound like there's two different kinds. There's one where it's focused on a partner and their appearance and feeling like obsessing about them not looking a certain way or being a certain way to you, and that may not be okay. The other one is worrying that this person isn't the one. I don't know if I love them enough. Those are the common obsessions. So, it sounds like you called yourself out that you are doing checking rituals like reassurance, and what ERP would look like would be having that intrusive thought or having that intrusive fear and not seeking reassurance and sitting with the discomfort of, I don't know if my best friend likes me or not. However, I know that I need to sit with the discomfort because continuing to seek reassurance not only is a compulsion, but it also might push the relationship away further. This book is great. It talks about common cognitive distortions that come up in relationship OCD. It talks about using acceptance commitment therapy to help you with relationship OCD. So I highly recommend this if you specifically have ROCD or even just anxiety in a relationship. Again, I know I keep apologizing, but I hope that made sense for you. All right. Leah, can you recover from pure OCD without treatment? I can't really give you an answer to this. All I know is, so let me first start with sharing. Pure OCD was a term coined by, I believe, Stephen, I might be saying it wrong, Stephen Phillipson. Oh, I hope that's right. Pure OCD is OCD. However, the compulsions are all mental compulsions. So it's not that you have, a lot of people, there's a myth that pure OCD means you only have obsessions, and that's not true. Pure O just means that your compulsions are mental compulsions. And you can look at mental compulsions just like any other compulsion. So I also don't believe that there is going to be, so recovery, I kind of want to know what you mean by recovery, because OCD unfortunately never goes away, but there's treatment to learn how to live a beautiful life and have more freedom from your intrusive thoughts. And so I'm not really sure what you mean by recovery, but you can also seek treatment for yourself if you can't get a provider. So you could utilize a book, you could reach out to cbtschool.com and buy the training and learn about it yourself. If you don't really know what the best thing to do is when you have OCD, it's going to be really hard to get that freedom and that kind of getting back to enjoying that amazing life that I want you all to have. So if you know that you have OCD or you're struggling with symptoms and you're not sure, yes, you can seek, you can get that help yourself by reading or learning about it yourself. But if you don't know what's best for you and you just try to do it like on your own, you could be reinforcing that cycle that will just make it worse. So the more you act out your compulsions, the more you're reinforcing in your brain that you should do these compulsions. And so it can just like skyrocket. You're welcome, Co. Let's see. Tiffany, my newest theme is relationship OCD. Awesome. Not awesome. I'm sorry you struggle with that, but it sounds like that might be the theme for today. I'm answering my thoughts now with I don't know instead of ruminating for answers, or the well, how do I know, or the well, how do I know how I feel? Is this avoidance or progress? The I don't know I believe is progress. Again, I would need to know more about your specific case, but just from this quick sentence, that's what I'm answering off of. Saying I don't know instead of trying to solve the obsessions or the questions that your obsessions are forming, saying I don't know is progress. Saying I'm noticing I'm having the thought about my relationship OCD, or I'm noticing that I want to answer these thoughts that are intrusive and I'm not going to, is definitely progress. Avoidance would look like doing something to try to distract from the obsessions. So it's not good to try to distract from the obsessions or challenge the obsessions, or avoid things that trigger you to have the obsessions. But not answering the obsessions, noticing them and moving forward with your life, that's not avoidance. That is progress. Evelyn Brown, how can you get through this? Evelyn, I'm so glad you're here, because you being here means that you found no CD, that you are recognizing what might be going on. And how you can get through this is joining this amazing community of support. There's amazing resources. Check out IOCDF. Check out IOCDF to see some resources that are in your area wherever you live. Check out No CD in their app and get information. Support from the community is going to help you get through this, in addition to first getting the right treatment, which is ERP. There are other treatments out there, but this is the one that, there's a lot of research on. It's the gold standard of care, which they always say. And so you can get through this by finding a therapist and getting support. This is really hard, and you can do it. All of you can do this. It's super hard, but all of you are amazing and resilient and can learn this treatment. And I will hold the hope for you if you're struggling to have it right now, okay? But I don't want you to give up. And that doesn't mean that you need to be practicing ERP every day, all day when you're exhausted. It means having that self-compassion of, I'm gonna do ERP, and sometimes when I need a break, I'm also gonna take a break. Can you talk about self-compassion a little and why it's important? And when you feel like you've been doing great and all of a sudden you have a setback and it feels like you're back at square one. Jalissa, thank you for asking this. This brings me to another amazing resource, which is Kimberly Quinlan's workbook. It's called The Self-Compassion Workbook for OCD by Kimberly Quinlan. Another amazing therapist, amazing book. She also has an incredible podcast called Your Anxiety Toolkit. And it's awesome. The episodes aren't that long. It's easy to digest. She talks a lot about self-compassion. Self-compassion is really important because, and it's been studied, that being mean to yourself, taking on that mean bullying coach stance, isn't motivating. A lot of people will be mean to themselves in order to get themselves to try to do something. They'll take on that coach mentality of like tough love. And they've actually found that actually isn't as motivating as acknowledging your pain, acknowledging your suffering, acknowledging that what you're going through is really, really hard, and leaving space for those emotions. That is what can lead you to have empathy for yourself and give you some room so that you can take those steps forward. So self-compassion is about not beating yourself up, not trying to reach perfection. And it's about noticing where you're at and showing yourself love. And that is going to, again, like I said, open up space for you to be patient with yourself so that you can do this work, because it is hard work. And so if you don't have that patience and that love, that compassion for yourself, it's going to be really hard to be tolerant of when it doesn't go perfectly, or be tolerant when you are really, really struggling with OCD. When you feel like you've been doing great and all of a sudden you have a setback and it feels like you're back at square one, that is when self-compassion would be beautiful to add in here. One of the self-compassion, I don't know if it's a pillar, but ideas is shooting for a B plus instead of like this perfect A. Can you allow yourself to be a B plus student in life versus this perfectionism? And that's so helpful with ERP, because ERP does not need to look perfect. When you feel like you have a setback and you're noticing that you're thinking you're back at square one, that's when you can bring in that self-compassion and that that mothering for yourself, where you can say, you had a setback. That's okay. That does not mean you're at square one. That just means that you are creating insight. Like the fact that you even noticed you had a setback is insight. Acknowledging that is basically just setting you up to kind of notice what you learned, go over that learning, maybe what made that happen, and moving forward. Recovery is not perfect. And this goes for OCD, and this also goes for addictions. If you have an all or nothing mentality, that is being harsh on yourself, and that is not being compassionate. You are gonna have obsessions and you are gonna have compulsions, and it is not gonna be perfect. And so it is not starting from square one. It is just your journey. And recovery is not linear. Recovery has ups and downs. And these are some of the things that you can also say to yourself to verbalize that compassion of, recovery is not linear. There's ups and downs. I'm not back at square one. I'm just on this path that's always moving forward, that might be going up or down. You're welcome, Tiffany. But this book talks a lot about self-compassion, and it's great. There's this story about, I don't know if you guys have heard this, but maybe you can tell me in the chat if you heard of it. But there is a story about it's like a Buddhist parable about the second arrow. And the second arrow is a story about pain versus suffering. And there's also a humorous YouTube video about the second arrow. But basically what it is let's say you get hit by an arrow and you feel real pain because this arrow hit you. That is real pain. Like, ow, this arrow hit me. This arrow is sticking into me. That is real pain. What happens a lot of times is after that, or when that happens, we start to have thoughts like, oh my gosh, I can't believe I got hit by this arrow. I was probably in the way. I'm so how could I have gotten hit by this arrow? This must be my fault. I'm so silly. How did I not know? Or it can turn into blame and getting really angry about this thing happening. That's the second arrow. The second arrow are the thoughts and the shame and the blame that we have about the pain that we're already experiencing. And so if you can notice those second arrow thoughts, that can help reduce suffering, and that it can help you raise more compassion of like, wow, I'm already in pain. It is not compassionate for me to then beat myself up about pain that I'm already experiencing. And she shares that in this book, that story. Let's see. Okay, I clicked on someone and now I got lost. Let's see. How can I keep my hands busy so I don't keep touching my face or my perceived problem areas on my body? Okay, so this sounds like it might be a question related to either, or it could be related to OCD, but there's also something called BFRBs, body focused repetitive behaviors. And it's actually BFRB this week. And BFRBs are treated a little bit differently, or I guess I don't even, BFRBs are treated differently than OCD. So with OCD, you don't want to do something that makes you unable to, or how do I say this? Let me think about this. How can I keep my hands busy so I don't keep touching my face or my perceived problem areas on my body? So, okay, let me restart this. I would want you to check out with your therapist if this is a BFRB or if this is OCD. If it's a BFRB, they have things called habit blockers. So if you keep touching your face and you can get certain things that you put on your fingers, you can put tape on your fingers, you can put you can cover your fingers with something, put gloves on, make it basically hard to touch your face. And it also increases your awareness. So if you have something on your hands and you go to touch your face, it will help you notice, oh, there's something on my hands, and it'll make you notice, oh my gosh, I'm touching my face. And I know that I don't want to do this because this isn't helpful for my either obsessions or my urges. So putting something on your hands can help you raise awareness to it. But keeping our hands busy might be a compulsion in itself, or it might be a distraction. So I'd want to know why you need to keep your hands busy versus can you notice, oh my gosh, I really want to touch my face right now and I really want to do it, but I'm working on not doing this. So can I put my hands down? Or what would I be doing with, a great question, what would I be doing with my hands if I wasn't touching my face right now, and do that. Another thing is, again, if this is BDD, I would want to, I'd want you to see a BDD therapist, but it says, or my perceived problem areas on my body, raising awareness and noticing the urge to do this so that you can intervene before you do the compulsion. Okay, let's see. Ron, hello. I have mainly perfectionism OCD. Having my checking compulsions feels like being an alcoholic, but at least drinking is fun at first. Checking is never fun, yet we feel that urge. Yes, I'm glad that you noticed that you know you have perfectionism OCD, so that the fact that you have that awareness and that knowledge is this huge step. And now it's noticing that urge, and can I ride that urge? Can I surf that urge? Can I do what I would do if I wasn't feeling this urge right now? So it isn't about avoiding or distracting. It's about acknowledging and noticing, which is really important, to not distract or like deflect or be in denial. It's to acknowledge it and notice it and then move forward. All right. OCD warrior. I don't know if I know the answer to your question, but I wanted to put it up here and give you some resources that may. So can you talk about false attraction? Is this something that can happen in taboo sexual themes? So I'm not really sure what you mean about the false attraction. I'm interpreting it as, can you have intrusive thoughts that make you question your attraction to someone? And yes, you can. And taboo sexual themes, just to talk a little bit about them. A lot of themes that are called taboo are like sexual orientation is a theme, having pedophilia OCD, so having thoughts about being, doing sexual acts with children or having those images. It could be having intrusive sexual thoughts or images about just random people in your life or family members that you wouldn't normally. So it can happen. So maybe I did answer that question, but I guess I would just need more clarity on what you mean by false attraction. But yes, that can definitely happen if that's what you're talking about. What are some tips for sitting with discomfort when the negative emotions are so strong and overwhelming, feels like I lose myself? So there are different thoughts on this. In terms of what to do. Some people feel like you don't need to do anything. You don't need to cope because you can handle the feelings. it's true that you can't handle the feelings. Some people feel like it is okay to use coping tools. So I think I would recommend, I would encourage you to kind of, if you do have a therapist, to kind of ask them how they feel about this. But some tips for being with discomfort, one is naming it. So, or noticing it, labeling it, and then some will say correcting it. But so the building awareness is the first thing. So that is noticing it. I'm noticing that I'm having this discomfort. The next is labeling it. So I'm noticing that I'm having these thoughts. I'm noticing that I'm having this really strong negative emotion. I'm noticing that I'm feeling angry. So like actually coming up with that emotion and labeling it. So talking about it, acknowledging it. Another thing is doing a body scan and either writing or speaking out loud to yourself or thinking about how you're feeling in your body. So when you said sitting with discomfort, when the negative emotions feel so strong and overwhelming, how do you feel that in your body? When you say discomfort or strong or overwhelming, what does that physically feel like for you? And say that to yourself and name it, because a lot of times discomfort is just physical sensations. And it can be helpful to separate it from what you're thinking it's about by just seeing it as a physical sensation. I have a quote on my Instagram that I can't think of right now, but one of the Johns, there's a lot of Johns in the OCD world that are amazing. There's John Hirschfield, Jonathan Greason, Jonathan Abramowitz, and one of them has a quote about this, but I can't think of it right now. But I think they talk about how anxiety is just physical sensations. So naming those physical sensations. Another way that you can be with it is not necessarily sitting and doing nothing. It's thinking about, what are my values? And if I wasn't thinking about this right now, if I wasn't having this urge or wasn't having the discomfort, what would I be doing today? Oh, I was told my friend I'd call them, so call them. If you feel like avoiding something because of your discomfort, what is your value? Your value is probably going and living your life and doing this thing. So really, it's not always sitting with discomfort. It's also moving forward with discomfort and living your life despite the discomfort. So can you do things in your daily life despite the discomfort? It's also having self-compassion for yourself and being able to say to yourself or out loud, wow, this is really hard. One of the self-compassion exercises is having like I think it's like a compassionate touch or I can't think of the way they call it, but basically like, where does it feel good and feel compassionate to place touch on yourself? So for me, a lot of times when I do this, I notice that I'll kind of like go like this. I don't even know if it's my heart, but to me, like going like this is comforting. For some people, it's going like this. So having a compassionate touch can really be helpful. Christine asked a great question because I talked about, can't really, there's no full, again, I would need to know what recovery means for someone. But to me, recovery is, I have OCD, I have intrusive thoughts. However, I no longer act out in I no longer act out in compulsions, or if I do, it's very minimum. So to me, that's recovery. Recovery is having intrusive thoughts, having intrusive images, and coming to a point of acceptance and not doing something about them. So that to me is recovery from OCD, and that to me is possible. What isn't possible is to never have these thoughts and to never feel the discomfort. That's my take on it. So the end goal is not acting out compulsions. The end goal is not having OCD interfere with your everyday life, interfere with work or personal or joy. So the end goal is to accept the parts of OCD that you may not like, but to accept that they're going to be there and that it no longer is really getting in the way of you living. Oh my gosh. Hi, Nathan Peterson. So great, who I just posted that gave me a wave and a clap. Great therapist. All right. And if you have anything you want to share, type out, please do, and I will share it. All right. Dar's phone Graves. Again, apologies if I don't say these names correctly. Hi, I know you may be trustworthy, but I really don't trust ERP. I don't think I would be in charge. I don't think I would be in charge, especially with HOCD, sexual orientation OCD. I hope it doesn't convert me. I'm not really sure what you're saying here. And I feel for you. Not everyone is going to understand or believe in ERP. So I'm sorry if I don't understand the message specifically, but I feel for you that it's something that you're not open to. Okay, Delta Smith. I feel like a completely different person as I progress through ERP, and I'm sure if I like this me. Is this a normal experience to feel like you'll never find yourself again? Yes, it is normal to be confused and frustrated and not feel like yourself when you're struggling with OCD or when you're in recovery or when you're working on ERP. And again, this is where I want you to hold on to that hope. You may not find yourself again, meaning like the person that you were before, because you can't go back and be the person you were before, but you can go forward and become this new person that hopefully has the things that you had in the past that made you feel good about yourself. But now that you have this knowledge you can't erase, you're going to find yourself into a new person that hopefully you love and enjoy. So it is normal, and I'm really sorry that you're struggling with this, and I'm really proud of you for doing ERP and doing that hard work. In regards to the end role, do the thoughts still cause distress? Yes. So yes, but everyone's different. So you can't make thoughts go away. And that's why ERP exists and why it's been proven to work. Is ERP is you're accepting the thoughts, you're accepting this uncertainty, you're accepting the unknown, and you're acknowledging that I can't get rid of the thoughts, but I can choose how I respond to them. I can choose what I do next. So there may be people that with OCD that you talk to that they don't have distress anymore because they understand they have OCD and they have practiced a lot and they've exposed themselves and they live their life despite their thoughts. And so maybe their distress has decreased, but everybody's different. And there's a lot of people who also say that the thoughts do still cause distress. I just respond to them differently. So it really depends on the person. And I would say be with the unknown of not knowing what's going to happen in your future with recovery, and just use it as an experiment and see what happens. Let's see. I feel like I've been going through grief of the years I lost to OCD and accepting all the pain I experienced. Any thoughts on post-recovery? Beautifully said. I'm really glad that you shared this. Grief is a huge part of this. And I think it's really amazing that you can acknowledge that you lost years to OCD versus some people haven't separated their OCD from themselves and they like blame themselves or they're mean to themselves versus what you're doing here, which is, wow, I have lost years to this OCD and I have a lot of suffering and I have a lot of grief because I know I've lost years to this. So I'm really proud of you for being in this place and working, acknowledging the grief and working through it. There's no time frame for grief. There's no right or wrong way with grief. I think the only wrong is doing things to hurt yourself or doing things that are unhelpful, just doing harmful things as a way to process grief. But besides that, there's no like perfect or right way or steps to go through that grief. I think post-recovery, I think you're doing it. I think you're doing the post-recovery by being like, wow, I did all this work. It sounds like maybe ERP is working for you and you're able to like notice not only your OCD, but the other components of your mental health, which is acknowledging this grief that maybe you have. All right. All right. Let me know if anyone else has questions. There's not as many like jumping in today as there normally is, so I can take a breath and share a couple more resources. So I already shared Relationship OCD, the book. I already shared the Self-Compassion Workbook for OCD. Another book that's great is the Mindfulness Workbook for OCD by John Hirschfield and Tom Corboy. And another one that I have a lot of clients that enjoyed or that they found helpful that actually kind of motivated them to do exposures when they were feeling kind of like resistant is this book called Overcoming Unwanted Intrusive Thoughts by Sally Winston and Martin Seif. So those are a couple of book resources. The OCD Stories is a podcast that's great. The Anxiety Toolkit's a great podcast. I'm sure there's others, but those are the ones that kind of I really like. What else? So yeah, those are some resources. Obviously, NoCD is an amazing resource. Jalissa, do you have OCD? If so, what does your recovery look like? So I do not have OCD. So I'm a therapist and I specialize in treating clients with OCD, anxiety, and eating disorders, as well as kind of difficulty just getting through different phases of life. But I myself do not have OCD. Hello, is it true talk therapy is bad for OCD? I'm going to a therapist and going through CBT, I think. I'm from Mexico and OCD specialists are rare where I'm from. Thank you for asking this question, Balbazar. I think that's right. So I'm glad you're here because that means you know about OCD and hopefully you can get support even though specialists are rare there. I would also check out the IOCDF website to look for providers in your area if you aren't connected with NoCD. So the idea that talk therapy is bad for OCD, the idea behind that is that it is not, if you have OCD, it's not helpful to talk out why you have it or like where it's coming from. Through research, they found that going through your past is not going to make the obsessions and compulsions lessen. It doesn't mean that it's not helpful to process your past or to like do talk therapy for other things that might be going along. There's a lot of other mental struggles that accompany OCD, whether it's generalized anxiety, whether it's depression. So talk therapy can be helpful, but not necessarily for targeting OCD, because what they have found through research is that doing behavioral therapy is what really helps OCD. So talking your way out of your OCD or thinking that you're going to get rid of your OCD because you explore the root of it, unfortunately isn't what's going to help, because a lot of this is a brain disorder where you have extra firing in your brain in the flight, fight, freeze, danger response in your brain. And so you can't really talk yourself out of performing compulsions. It's practicing it and actually having to do it. There's different types of CBT. So like CBT is a big umbrella term, and ERP is a type of CBT that focuses more on the behavioral component. Whereas there's other CBT that isn't helpful for OCD. An example is when you're using CBT to challenge your thinking. And that isn't what's been found to be helpful for treating OCD. Artist Polar Bear, what a cute name. I'm pretty young teen and I recently started to link some symptoms I experienced to OCD. I don't have the ability to sign into therapy at the moment. I'm not sure what to do or where to start. First of all, being here, you have already started. So knowing about NoCD, you have started, because if you're not able to sign up for therapy, like one-on-one, I would utilize the NoCD app to get information. I would listen and read some of the resources I recommended. Now, if you have these resources and you're going to them nonstop, that could be a compulsion. So you want to make sure you're not using these resources as a compulsion. What you can do is, if you go to CBT school, there is what's called ERP school, where you can pay and you can learn how to treat OCD yourself. You can listen to different podcasts to help educate yourself about OCD, because psychoeducation can drastically change your relationship with OCD. If you're knowledgeable about it and you understand what it is, that alone can really help reduce some of the pain. So getting one of these books, checking out those podcasts, learning about it. ERP school is a great resource for some people that can't see a therapist, or they don't have someone in like where they live. ERP school is great. No CD, I know, covers, I believe it's worldwide. So hopefully that is something they're able to do in the future, but you already have started. So I'm really proud of you for finding this. There's so many resources. So if you need specific names or you need me to repeat those or something, you can follow me on Instagram at Jackie Shapin Therapy, and I can DM those to you if you want, if you weren't able to get them just now. I'll repeat them at the end of this though. Blake, my compulsions are mainly mental and not physical. What can I do to stop these compulsions? Oh man, mental compulsions. I said, oh man, because a lot of people think that like they're so different from physical compulsions. They may look different because you're not physically doing something in space. But there are many ways that you can reduce mental compulsions. Allegra Castins, who is on Instagram as Obsessively Ever After, she just did a talk on mental compulsions. You might be able to get a copy of it. But she also has a lot of posts on this. So again, I'm going to go over this again because it's really helpful, but with mental compulsions, one thing that's helpful for all of this is diffusion techniques. Thought diffusion, or just diffusion, is creating space between your obsessions and the compulsions. And if you can create that space, then it can help you respond differently instead of reacting and exercising a compulsion. So a couple thought diffusion exercises. One is, like I said, noticing. Start increasing your awareness. Start noticing when you're having these obsessive thoughts or images or ideas. Those are all obsessions. So one thing is naming it, like labeling it and noticing it. I'm saying this out loud and actually saying it. It may not feel like it does much, but it does, because it creates even this much distance between your thoughts and your behavior and your like response to your thoughts. So again, an example would be, I'm noticing the thought that I'm worried that I want to have sex with this child. I'm noticing the thought that I want to grab a knife and stab my wife. I'm noticing the thought, or I'm noticing it may not even be it could be a command or it could be a question, but I'm noticing all these what if thoughts. I'm noticing that I'm having intrusive thoughts, labeling it, and then deciding, what do I want to do? Do I want to keep paying attention to it and ruminate? Or do I want to notice that I want to ruminate, and instead I'm going to sit with the unknown and think, maybe not, and lean towards your values. Also on my Instagram, I'm going to be sharing about mental compulsions and different ways that mental compulsions show up, because there's many of them. And a couple of things about how you can do. Just off the top of my head, I can't name all of them right here, but that will be coming soon. But being aware of them and noticing. Notice if you're ruminating. Notice the time. Wow, it was just an hour and I was thinking about this thing over and over again. Label that compulsion, rumination, trying to figure it out. Other mental compulsions might be praying in your mind, or counting in your mind, or going over a scenario over and over again. If you can notice it and be aware of it and be able to label those compulsions, that is huge, because then you get to decide what you do. You get to decide whether or not you're going to pause and not do it anymore, or if you're going to keep going into that spiral. All right, so we only have a couple more minutes left. Let's see. Thank you for mentioning CBT school. I hadn't heard about that before. It's great. It's really great. It's by Kimberly Quinlan, and she has a few trainings on there. I can see your website. You do EMDR. Can EMDR help with traumatic experiences that may be fueling some of the OCD? So there isn't enough research on EMDR and OCD, and there's no proven, so there isn't enough research to make EMDR, to know if EMDR is effective for OCD. I don't necessarily want to talk about that on here because I'm here to talk about OCD, under NoCD's platform. So if you do have questions about that, you can message me separately about that. Thank you, Sabrina. Let's see. What do you do when your PTSD goes with your OCD? For example, I have a fear of knives because something horrific I witnessed, so I practice exposure with knives. So I really want you to see a therapist so that you kind of have a better understanding of what exposures would look like and talking out examples, because our anxiety there's adaptive anxiety and maladaptive anxiety. And it's really important to notice the difference between helpful anxiety and not. If we didn't have any anxiety, we would get ourselves in so much trouble, and we would, do things that would cause pain. So there's a helpful component to anxiety. Anxiety is there to keep us safe. And so it's important that you have someone that you can talk this out with so that you can come up with exposures that are going to be helpful versus unhelpful. But on a basic level, if you have a fear of knives, touching them, cooking, like eating with them, holding them, if you do have a fear of that, then yes, basic answer is yes. Practicing doing those things is going to be helpful. You want to rate, so there's something called subjective units of distress, which is just basically a 0 to 10 or 0 to 100 scale of how bad your distress is. And so if you have a distress of like 10 to like pick up a knife, then that's not going to be where you want to start. If it just sounds impossible to all of a sudden do exposures with knives, there's exposures that you can do that can help get you to that point. You could write scripts about holding a knife. If they give you anxiety, then that's good homework. You could look at knives. So it's not just having to hold a knife and pick it up and there's your exposure. There's different levels depending on your anxiety. All right, so we're at that time. I hope that was helpful. I was a little flustered coming in because I was late. And so hopefully what I shared was helpful. If anyone needs clarification or wants to, ask more questions, NoCD does these lives very often, sometimes with experts and sometimes with advocates that have OCD. If you, so use NoCD. It's great. If you do want to find me or get more clarification on something I specifically said, you can find me on Instagram at Jackie Shapin Therapy. And I hope that was helpful, everybody. Artist Polar Bear, says thank you so much. That was super helpful. I tend to struggle to discrowd my thoughts when I'm around people more than when I'm with myself. What could help? I'm so sorry I don't have time to answer this, but I'm glad that this was helpful. Please show up again, because then you can ask this question and someone will answer it, because NoCD does these a lot. Have an amazing OCD awareness week and a month, and get involved. You are not alone, and there is a huge community here to support you with some great events coming up. You're welcome, and you also have a great rest of your day.